The DeTACH Detachable Aortic Cross Clamp Head device is a detachable cross clamp head used for temporary or partial occlusion of blood vessels during cardiovascular procedures. The jaws of the clamp head are covered with atraumatic flexible tissue engagement pads. The upper jaw pivots independently in relation to the pivot jaw actuator arm and the lower fixed jaw to allow for parallel closure at distances between 5 mm and less. The clamp head also incorporates a cam-style locking mechanism to lock the jaws in the closed position after detachment from the delivery device. The detachable clamp head is available in small, medium, and large sizes, 55 mm, 65 mm, and 85 mm tissue engagement pads respectively, which are packaged and distributed separately. The detachable clamp head utilizes the DeTACH delivery device to deliver, clamp, deploy, unclamp, and retrieve the detachable clamp head to and from the target occlusion site. The detachable clamp head also utilizes the DeTACH quick release device to release and retrieve the detachable clamp head from the target occlusion site in the event that the delivery device becomes compromised during the course of a procedure. The delivery device, quick release device, and sterilization tray are reusable accessory devices that need to be cleaned and sterilized before use and are packaged and distributed separately. Detailed overview of device components. The detachable clamp head used for target vessel occlusion is comprised of the following components. The jaw actuator arm moves the top jaw between the open and closed position in relation to the lower jaw. Within the jaw actuator arm is an angled slot known as a cam. The round and movable part found within the cam is known as a cam driver. The back and forth movement of the cam driver within the cam causes the actuator arm to open and close. The proximal end of the cam driver is known as the cam driver pin. The cam driver pin connects and couples with the jaw actuator wire within the delivery device to move the cam driver back and forth within the cam. The ribbed portion on the proximal end of the clamp head is called the engagement flange. The engagement flange is the portion of the clamp head that engages with the delivery device to connect the two parts. Within the proximal end of the engagement flange is a recessed cavity, which is the receptacle that the cam driver pin and jaw actuator wire are able to move in and out. The suture eyelet hole is found on the inferior aspect of the clamp head, just distal to the engagement flange. The stationary portion on the inferior aspect of the clamp head is known as the lower fixed jaw. The pivot jaw is connected to the actuator arm on the upper aspect of the clamp head and can pivot independently of the actuator arm and the lower fixed jaw. Both the pivot jaw and the lower fixed jaw are overlaid with tissue engagement pads. The delivery device used to deploy the detachable clamp head to and from the target vessel is comprised of the following components. The tubular portion of the device is known as the shaft. At the distal end of the shaft is the engagement grasper. The engagement grasper clasps and couples with the engagement flange to attach the delivery device to the clamp head. The engagement grasper trigger opens the engagement grasper when pulled and closes the engagement grasper when released. On the proximal end of the delivery device is the handle. Within the body of the handle, there are 4 flush ports, which are used for device cleaning purposes. The jaw actuating lever is found within the mid portion of the handle. When the jaw actuating lever is alternatively depressed back and forth, it moves the jaw actuating wire inside of the shaft to open and close the clamp head. The quick release device used to release and retrieve the detachable clamp head from the target occlusion site is comprised of the following components. The most proximal aspect is known as the plunger handle. Just distal to the plunger handle is the shaft of the device. Distal to the shaft of the device is the engagement hook. The engagement hook is the component that engages with the cam driver pin to unlock and open the clamp head. The spring-loaded finger grips can be found on either side of the plunger handle and are used to move the engagement hook back and forth. A flush port can be found in the middle portion of the plunger handle and is used for device cleaning purposes. The sterilization tray is comprised of 2 parts. A sterilization tray lid, which has bilateral locking latches to secure it to the tray base. and the sterilization tray base, which is pre-configured with receiving slots for the DeTACH delivery device and quick-release device. To prepare the clamp head for use, close the jaws of the clamp head by pushing the cam driver pin into the engagement flange until upper and lower tissue engagement pads are touching each other. Pass a suture through the suture eyelet hole and knot the distal ends together. To prepare the delivery device to engage with the clamp head, depress the engagement grasper trigger by pulling with upper fingers to open the engagement grasper until the opposing sides of the grasper are separated and in the completely open position. To position the clamp head and delivery device, continue to depress the engagement grasper trigger to keep the engagement grasper fully open. Position the clamp head engagement flange completely within the opposing sides of the open engagement grasper to prepare to connect the two parts. The position of the lower fixed jaw should always be inferior in relation to the pivot jaw, and the orientation of the clamp head should be such that the pivot jaw is superior in relation to the delivery device handle. To engage the clamp head with the delivery device, release the engagement grasper trigger to allow the opposing sides of the engagement grasper to close around the clamp head engagement flange. Inspect the engagement grasper to ensure that the opposing sides are securely closed around the engagement flange and that the clamp head is securely attached to the delivery device. To engage the jaw actuating mechanism, slowly depress the lower half of the jaw actuating lever until the actuator wire within the delivery device shaft engages with the cam driver pin on the clamp head. Once the actuator wire engages with the cam driver pin, slowly depress the upper half of the jaw actuating lever to open the clamp head jaws completely, and then slowly depress the lower half of the jaw actuating lever to close the jaws. Confirm that the device is fully functional by opening and closing the clamp head jaws multiple times by alternatively depressing the upper, then lower halves of the jaw actuating lever. To deliver and position the clamp head, use the delivery device to introduce the clamp head into the working field such that the upper and lower jaws are positioned on opposing sides of the target vessel to be occluded. To clamp the target vessel, ensure that the position of the target vessel is within the medial aspect between the proximal and distal ends of the tissue engagement pads of the upper and lower jaws. Then slowly depress the lower half of the jaw actuating lever to close and lock the jaws until the vessel has been adequately occluded. Inspect the site to ensure that another structure is not unintentionally clamped within the distal end of the jaws. This device is capable of providing large clamping forces that are necessary in only the most challenging cases. Do not apply pressure that is too far beyond what is needed to provide occlusion. The delivery device is equipped with a safety mechanism that will not allow the operator to exert clamping forces strong enough to damage or break the clamp head components. In the event that the safety mechanism is activated, the operator will hear a loud clicking noise when the internal actuating mechanism disengages, and the lower half of the actuating lever will become immobilized in the fully depressed position. To assist in re-engaging the internal actuating mechanism, operator can place thumb on the upper aspect of the back of the handle, then firmly and fully depress the upper half of the actuating lever to allow the lower half to return to its primary position. Once the internal actuating mechanism is re-engaged, to re-engage the jaw actuating mechanism with the clamp head, slowly depress the lower half of the jaw actuating lever until the actuating wire within the delivery device shaft re-engages with the cam driver pin on the clamp head. In order to verify that the jaws are in the locked position, there are 5 ratchet points within the lock zone that provide tactile and/or audible feedback to the operator to confirm that the cam driver is within the cam lock zone. The operator should feel and/or hear at least one of the ratchet clicks to verify that the jaws are locked in the closed position. If the operator does not feel and/or hear any ratchet clicks, the jaws are not locked in the closed position. Upon verification of adequate vessel occlusion, and with verification that the clamp head jaws are in the closed and locked position, to disengage the clamp head from the delivery device, depress the engagement grasper trigger to open the opposing sides of the engagement grasper to release the clamp head engagement flange. Once the engagement flange has been released from the opposing sides of the engagement grasper, continue to depress the engagement grasper trigger and slowly retract the entire delivery device away from the clamp head engagement flange to fully disengage the clamp head from the delivery device. To prepare to re-engage the clamp head to the delivery device, depress the engagement grasper trigger to open the opposing sides of the engagement grasper to prepare to re-engage with the clamp head engagement flange. While continuing to depress the engagement grasper trigger to keep the engagement grasper in the completely open position, direct the delivery device to position the engagement grasper so that the clamp head engagement flange is positioned completely within the opposing sides of the open engagement grasper to prepare to reconnect the two parts. To engage the clamp head with the delivery device, release the engagement grasper trigger to allow the opposing sides of the engagement grasper to close around the clamp head engagement flange. Inspect the engagement grasper to ensure that the opposing sides are securely closed around the engagement flange and that the clamp head is securely attached to the delivery device. To re-engage the jaw mechanism for repositioning or removal, slowly depress the lower half of the jaw actuating lever until the actuator wire within the delivery device shaft engages with the cam driver pin on the clamp head. Once the actuator wire engages with the cam driver pin, depress the upper half of the jaw actuating lever to unlock and open the clamp head jaws completely for either repositioning the clamp head on the target vessel or removal of the entire assembly from within the working field. Utilization of the quick release device. In the event that the delivery device becomes compromised during the course of a procedure, the quick release device should be used to release and retrieve the detachable clamp head from the target occlusion vessel. The quick release device utilizes an engagement hook to engage and couple with the cam driver pin on the clamp head in order to pull out the cam driver pin to unlock and open the clamp head jaws for disengagement from the target vessel and removal from the working field. To engage the quick release device, stabilize the proximal end of the clamp head utilizing surgical forceps or equivalent atraumatic instrument. Position the quick release device so that the engagement hook is aligned with the inferior surface within the receptacle on the proximal end of the clamp head engagement flange, and such that the notch in the engagement hook is facing the superior aspect of the receptacle. Push the engagement hook into the receptacle until it bottoms out within the receptacle. Raise the engagement hook up until it engages and couples with the cam driver pin. To activate the quick release device, slowly depress the proximal end of the plunger handle until the distal end of the shaft presses against the proximal end of the clamp head engagement flange. While keeping the shaft pressed against the engagement flange, slowly pull the finger grips to unlock and open the clamp head jaws. When the jaws are completely open, continue to pull on the finger grips to disengage the clamp head jaws from the target vessel and remove the entire assembly from within the working field. Thank you for watching today. For more information about the DeTACH detachable aortic cross clamp, visit us at www.coresim.com.